the time of birth and the time of death, which the destiny decides. So, Adethara, the event that is happening in Bangalore is a very prestigious event, and I'm thankful for the parent organization, FOGSI. FOGSI is now a familiar name with the media. FOGSI, Federation of Obstetricians and Gynaecologists Societies of India. We are 33,500 members, and half of them are here in Bangalore, right across at Palace Grounds, at the 62nd Annual Congress of Obstetrics and Gynaecologists. The last time we had this Congress was in the year 2003. That's because the conference of this stature, which happens once every year, rotates from region to region, and the south of India gets its turn once in every 4th year, and so between Andhra Pradesh, Telangana, Kerala, Tamil Nadu, Karnataka will get its turn once in X number of years. So 2003 to 2019, we are indeed proud and privileged to host this Congress. I would just like to introduce very distinguished members from our organization who are sharing the dais with me here to address you. The past, present, and future, when we say. Actually, FOGSI from the city of Agra, our very senior past president, Dr. Narendra Malhotra, first time said, Beti Bachao, Beti Padhao, and then the government took that over. And in continuum, as though it were, we had several programs and themes and taglines through the years, and the past president, Krishna Pai, said, she matters. And the present president, Dr. Jaideep Malhotra, said, give her the wings and she will soar. And the future president, Dr. Nandita Patkar, says, we for Stree, safer, stronger, and smarter. That is the continuum. To keep this continual thread moving ahead is Dr. Jaideep Tang in the position of Secretary General of FOGSI, who has to collectively combine the forces of many intellectuals in this country. And believe me, the way we agree to disagree, and there are so many things that need to be sorted out for a mammoth organization like this, is really an uphill task, and we appreciate the voluntary time and efforts that the office bearers give to our organization, surely because of their dedication and commitment. The tagline that we have chosen for this Congress in Bangalore is women's health is nation's wealth. All of us agree on that, because everything starts from the women in the family, pregnancy giving rise to the new lives. So everything that happens to her and her child even before her birth, that is an initiative of incredible motherhood, or Adbhut Matritva, which Dr. Jaideep will deliberate, which was one of the strong focuses during her year. Well, the mother and her health, responsible not only for the present but also the future generation. If you plant a mango tree, you cannot expect apples. You reap as you sow. So that is the philosophy with which we are saying women's health is nation's wealth, because you keep the girls and women in your country healthy. It is not only reproduction that she will offer. Intercourse, it's production. The whole country becomes productive and prosperous because health is wealth. So, in keeping to that philosophy, there are a variety of issues that are being discussed and debated in this Congress, with more than 250 faculty of speakers, very distinguished experts from all over the world who have come into the city of Bangalore. More than 2,500 Indian speakers who are experts in a variety of subjects who have gathered under one roof. There are 12 different workshops as we speak here today happening in different parts of this city to teach the skills of advanced technology and surgeries. And there are several other symposia and keynote addresses, as well as the orations that would happen, driving what is best from the past, driving ahead what is good for the future generation. A lot is being talked about the lifestyle and the new era, non-communicable diseases. So it's under one umbrella, everything that the girls, the mothers, and the elderly, the whole spectrum is being covered at this mega Congress. The Congress, of course, will also witness the heritage of Karnataka. Each of the halls are being labeled as the Hampi, the Badami, the Chamundi, so that everybody who comes into the ambience of the palace grounds knows about Karnataka, while as they discuss the subject as well. The cuisine, which is being well laid out, the evening programs with the Vijay Prakash show and the Hindarupa Foundation Fusion Music and the Vishaya Bhushan show, etc., will also be a treat to the delegates who have assembled. We have more than 12,500 gynecologists who have had their footfall at the palace grounds from this morning onwards. So the conference will end by 2 p.m. on the 12th of January, by which time each person who has attended the Congress, we will sensitize them to the fact, indeed, that women's health is nation's wealth. So with these words of introduction to our distinguished guests and the event, may I now kindly request the present President, Dr. J.D. Malhotra, who hails from the city of Agra, who has taken many strong and bold initiatives this year to reflect upon what her contribution was to our great organization in the year 2018. Dr. J.D.
Thank you, Hema. And
I just want to inform that this press conference is going live.
thank you, Hema, and thank you to all the members of the media. It's a pleasure to be here and addressing you as the president of the organization, of a very big organization. We are 36,000 obstetricians and gynecologists, members of this federation, which we call as FOGSI, and we are represented in 248 societies of our country. As the president, every president has onus of bringing in a lot of corrective steps towards a primary mission. Our primary mission is to reduce the maternal mortality ratio in our country, and our other mission is to look after our fraternity and our members and our doctors. And so this year, I gave the theme, Give Her Wings, Let Her Soar, where her stands for that HER is health, empowerment and respect for the women of our country, which has to be provided by QED, which is quality, ethics and dignity by us doctors. And this is very important. In our country, we are 1.34 billion strong. Now, what is important is that out of this, 50% of the population is female population. And more than 40% of our population is young population, which is very important. They are under 20. Now, looking after the health of the women, we cannot take the nation forward without taking the women forward. So, indicators of any country are basically based on women's health. So, that's why looking forward to the women is very, very important. Now, in our country, we have almost 26 million babies being born every year. And we are only about 1 lakh of obstetricians and gynecologists. Now, we cannot do justice to the kind of care every woman deserves in our country. So, we took up a lot of initiatives this year which are very important. Second very important factor which I worked on with the Federation this year was building up the doctor-patient relationship. Because that had really gone down a lot. The public expectations are very high and we are very low in numbers to actually come up to their expectations. Third important thing was quality, ethics and dignity in the practice of us doctors, which was important. Because I really feel that if somebody has to really move forward. Now, if the health indicators have to move forward, we have to awaken the women. Women are the pivot of any family, society or nation. So if a nation has to move forward, then the women have to be awakened. Because then only the family, society and the nation will move forward. So that's why we concentrate much on these. So the projects which we took up had a lot of depth in them. One was to build up the patient-doctor relationship because pregnancy is the main issue which we look into. So incredible motherhood, as Dr. Hema was telling, or Adbhut Matratva, I would say, is a program which has been developed by FOGSI this year, which is on a holistic approach towards pregnancy. Now today, India is the diabetic capital of the world, obesity capital of the world. We have maximum number of premature deliveries in our country. Now all that cannot be reduced if you are only looking at pregnancy. We have to start from adolescent, I would say in utero, and then move forward. So Adbhut Matratva is all about from preconception care to postpartum care, looking at preparing women on looking at pregnancies which will have long-term effects on the non-communicable diseases which are happening in our country. The second very important aspect was that we actually are now training and defining quality criteria to our members, which is a project called Manyata, which has been taken up by FOGSI in a very big way for private practitioners, because defining quality criteria to have nice impact is also very important. So that is being taken over. Then training of the nurses, Samarth initiative of FOGSI, which is there, because most of the nurses are only trained in a certain areas. We are training them to look after pregnancies in a much better way so that the maternal mortality can come down. And we have also this year given a software free to our members to document, because once you document, then only the data will come. Because our country is drift country. We are data rich, we have numbers, but we are very poor in information. So that is also which we have taken up in a big way this year. Lastly, Akshay Jeevan is another project which we have done, which is, screen the mother and immunize the daughter for cancer cervix, which we have joined hands with FICCI Flow and also Rotary International, and even the government of India is also supporting. I'm very proud to say that our Adbhut Matratva program has been so much accepted by the government of India that the health minister himself has announced that we are going to link it up with the Pradhan Mantri Surakshit Matratva Abhiyan. And we'll take the public and the private sector together into holistic management of pregnancy. So these are just in a gist. We are doing a lot of other things, but this is in a gist the 4 major projects which were taken up this year. And I feel very happy that we have done very well. Thank you very much.
Thank you, Jaydeep. You have seen such a massive flow of the agenda. There is more to come. So, as how we speak to you today, at level 1, we are having a organizing managing committee meeting of FOGSI, which will discuss and deliberate on what has been going on and what is the way forward. Since Dr. Jaydeep Tang, the Secretary General of FOGSI, will have to quickly move back to the official meeting, I thank him first of all for making time for the deliberations with the media. We normally start the managing committee meeting at 2 p.m. But you would notice that today we are starting at 12:45. It's already started actually because there's lots more to discuss. The journey is really long and it seems never ending, but we have taken not one step but several steps ahead, and I want Dr. Jaydeep Tang to tell us something more on what the organizational way forward is. Jaydeep.
Thank you very much. Thank you very much to the Bangalore Society, first of all. Thank you very much to Dr. Hima Divakar, Dr. Sheila Mane, and all who have put together this absolutely wonderful conference. I'd just like to begin by telling you a little bit about FOGSI. FOGSI is the Federation of Obstetrics and Gynaecological Societies of India. It is an association of professional doctors. We currently have something like 34,000 members spread across the length and breadth of the country, and we have 250 local societies. We have just crossed 250 local societies in this particular managing committee. Our headquarters is in Mumbai, and FOGSI exists to serve women and ensure optimum health for women, and also to work for its members. So you can understand that we have a kind of a bi-lobed, if you will, responsibility. In women's health, we advocate on various issues. For example, you might have heard about the oxytocin issue, which was in the news recently. And you must have also heard that this order has been taken back. I'm very happy to say that we played a leading role in this, led by our president, Dr. Jaideep Malhotra. FOGSI came out with a statement on the oxytocin issue, and our point was not whether anybody can manufacture or not manufacture. Our only point was that women who need oxytocin at the point of care tend to need it in a very distressing situation, in a situation where if the supply of oxytocin runs out, her life is at stake. All that we were telling the government was that please don't disrupt the existing supply chain. Please make sure that oxytocin continues to be available for women continuously, in a smooth manner, and in the manner in which it is available now. Another issue that we advocate very passionately about is abortion. For example, you must have read all the news reports about teenage girls going for late abortion and unfortunately having to go to court to seek permission from the court to have this abortion performed for them. Mind you, these are 11 and 12-year-old girls who have been raped repeatedly, most often by relatives of some sort. And it's such a pity, and I always like to say this, that when a girl or a woman is in that situation, she does not need to see her lawyer. She should go and see her doctor. But unfortunately, even doctors' hands are sometimes tied by the law, and we've been continuously advocating with the government, requesting them to look into the matter and try and make it easier for these girls to obtain the safe services that they so richly deserve. We also advocate quite fervently on various issues like Beti Bachao, Beti Padhao, gender-based violence. Cesarean rates is another issue that we have been talking about quite a lot, and we feel that a very skewed picture has been presented about cesarean rates. There is no argument that cesarean rates are higher in the private sector, but unfortunately why cesarean rates are higher in the private sector has not been explored completely, and neither has it been reported adequately. There are very good reasons why section rates are a little higher, and I must put this here that section rates in private sector are not uniformly 70 and 80%. They occur in isolated examples, and unfortunately these isolated examples are the ones which were picked up and reported on. I will have to leave now, madam, so if you will permit me. Thank you very much again to all of you for coming here. FOGSI is delighted to come to Bengaluru. We love Bengaluru, and we hope that we can come back soon. Thank you very much.
Thank you, Jenny. Holding responsible posts and positions, you know, one person cannot be here and there, everywhere. So as the common quote goes, because God can't be everywhere, He's created mothers. So we are all making our very sincere attempts to do the best for the girls and mothers in the country. Last but not the least, what we have done in the past reflects also what we would do in the future. If you've not done anything today, you can't have a better tomorrow. Keeping to that philosophy, I would request Dr. Nandita Palshetkar. We're all excited that she will be now stepping into the shoes of the president of FOGSI for the year 2019-20. What is her vision what is her mission for the organization, when she occupies the topmost position leading a prestigious organization like FOGSI as the president of the organization, Dr. Nandita Pacheco.
Good afternoon, everybody. I come from Mumbai and welcome here, and thank you for being here for us. The last census of 2011 said women are nearly 48% of the population. So if you look at it, we are dealing with half the population. And FOGSI has been a custodian of health and hygiene of women for a very, very long time. But now, since the past couple of years, as Jaideep has mentioned, we've taken over her other aspects. And that is where my team came. We for three, safer, stronger, smarter. And I think these three aspects are very important in a woman. If you see the MMR, the maternal mortality rate in our country, today is 130. 10 years ago, it was 254 women died out of every 1 lakh women. What has made the difference? FOGSI has contributed to it. We've run programs, the EMOC, that's emergency medicine or obstetric care program. And all this have helped in teaching, the paramedicals, the health workers, the nurses, everything. So we have actually made a difference. This is a very tangible example where FOGSI has made a difference. And I'm sure by the time another decade passes, you will see the work that we are all putting in now will definitely help. The other thing is that I'd like to point out is nearly 20 to 30% of the women who are pregnant are high risk. Now that is the population that needs extra care, needs our effort, and that is why we are conducting a lot of CMEs all across. And I think the Pradhan Mantri scheme also, last year they evaluated a lot of women and 5 lakh women were found high risk out of it. So all this is actually helping in making them safer. The other thing that I wanted to talk about is contraception. In our country, unfortunately, what is happening is 80% of the women are going for sterilization. There is very less usage of oral contraceptive. Probably because of the age-old myths, Purane Zamane mein, they used to say that you put on weight, it has problems, this, that. But the new contraceptives that have come are really good. No side effects, very minimal side effects. So that knowledge has to go to the people. Because now all the other world is concentrating on reversible contraception. But of course, I feel, personally, that's my feeling that in some of our states, we still need sterilization and it should be done. The other thing that I would really want to talk about is smarter. We have to make our women smarter. Women have, there has been a change. 80% of the deliveries today are institutional deliveries. And that is a major change. The only problem is every 1 out of 7 women does not get antenatal care. She does not get that care which is actually required, which should start from the first trimester. Pehle 3 mahine se we must start taking care of her. And only 16% of rural and 30% of urban, even city, only 30% women go and take antenatal care. I think we have to educate them to make them smarter, that this is good for them and for the next generation. The other thing that I'm really thinking of is unsafe abortions. Jaideep briefly touched upon it, but in our country, we do nearly 11 lakh abortions. And if you see that these abortions, 80% of them are medical abortions done outside medical facility. So if they're being done by the appropriate people, it's good. But this advocacy has to be spread. We don't need abortions, we need contraception. We should prevent these abortions. So that is something also that we are working on. And for the stronger woman, I think life expectancy today's woman is 70 years. And we want her strong. Strong from what? Strong from abuse of any kind. I mean, there's domestic violence, there's verbal abuse, there can be, other things. Do you know that the global health industry to which women contribute is nearly $3 trillion? And in that industry, how many women are there? 80% of women. And out of them, 50% don't even get paid or go unrecognized. There's a lot, I'm talking about health because I'm in health. There's a lot of discrimination against women in the health industry. And that needs to be corrected because I was reading some statistics. CEOs in America, in a hospital, there are only 17% women CEOs in the health. I mean, you know, we need to help our women, as Jenny previously said, that the women, if they come forward, the nation's wealth goes up. So yes, I think we are working for the women. We are looking at not only their health, also their future. And as Jenny also mentioned about Hema, I think you also spoke about cervical cancer. The biggest killer in our country is cervical cancer. And do you know something? It can be prevented. So we are doing a program which is known as Wellness of Women next year, where the focus will be on cancer screening and prevention. So we will be doing pap smears, we will be, propagating vaccines for these people. And, I've got a number that 1.23 lakh women suffer from cancer per year and 7,000 die from cervical cancer annually. Can you imagine this 67,000 is preventable? So we have a lot of work to do. We need to really reach out, and I'm so happy that all the FOGSI presidents are now working towards it. And we are a drop in the ocean, but you guys can multiply that drop many times because I feel awareness, advocacy is really important. So I'm really happy that you're here today and you'll probably talk about these things. So yes, my V for 3, safer, stronger, smarter. That is my theme for next year, and that is how the whole team FOGSI is going to be working next year. Thank you, thank you.
Thank you very much, Nandita. She has very strongly put it that the women need to be strong and safe and, of course, smarter, because there are several ways of doing things, but what you can do quickly should be a smart way to achieve your goals. And I'm happy that the leadership in FOGSI is a continuum of the same thoughts, same philosophy, because years ago when we said, ಹಲವಾರು ಮಾಧ್ಯಮದ ಬಂಧುಗಳು ನನ್ನ ಹತ್ರ ಮಾತಾಡುವಾಗ ABCDE ಅನ್ನೋದು ನೀವು ಹಲವಾರು ಸತಿ ಅದ್ರ ಬಗ್ಗೆ ಬರೆದಿದ್ದೀರಾ ಕೂಡ. A for anemia and adolescent care, B for building contraceptive choices, C for cervical cancer, D for diabetes, and E for emergency care, etc. ಯಾಕಂದರೆ ABCD ಮುಗಿಯಲ್ಲ, ಇನ್ನೂ ಬೇಕಾದಷ್ಟು ಕಥೆಗಳಿದೆ. ಆದರೆ ಆ ಎಕ್ಸೆಟ್ರಲ್ಲಿ ಯಾವುದಕ್ಕೆ ನಾವು ಫೋಕಸ್ ಮಾಡಿಬಿಟ್ಟು ಅದನ್ನು ನಾವು ಯಾಕಂದರೆ ದಿಸ್ ಇಸ್ ಸಚ್ ಅ ಬಿಗ್ ಕಂಟ್ರಿ ಆ್ಯಂಡ್ ಸಚ್ ಅ ಚಾಲೆಂಜ್ ದಟ್ ಒಂದು ವರ್ಷದಲ್ಲಿ ಇವ್ರು ಮಾಡಿದ್ದು 3 ವರ್ಷ ಮುಂದೆ ನಡೆಸಿದ್ರೆ ಅದು ಸಾಕಾಗಲ್ಲ, ಮಾಡ್ತಾನೇ ಇರಬೇಕು. Somebody has to pick the thread and keep doing. The same thing, each of the FOGSI presidents, though the post is only for 1 year and they put in a focus work for that year, that's a new start for a continual journey by everybody in the organization, because once is not enough, 1 year is not enough, and till we see the outcome translated into something that is perceivable, something which can make a difference, something which, when we say India is changing, yes, even on the health parameters, it would be our vision and pleasure to see that changing. So we conclude by saying women's health is nation's wealth. So let's do our best to have a healthy and a wealthy nation. If I can be just handed over the souvenir that we are going to release at the inaugural, but this is just for a photo op that I request our leaders to. They are used to several photographs like this, so we get another one.
And all of you can also have an informal conversation, shaking of hands, wishing good luck.
Sir, on the side. Bani sir, excuse me.
We can go for the individual bites quickly because all the
three, they are all, past FOGSI presidents incoming. We have a management committee meeting. So all the quick bites and quick interviews, we can quickly start now. And those who are not going to have any quick bite interviews, those media crew can just go and have lunch. Thank you.
ಲೈವ್ ಇದೆ ಸರ್. ಸ್ವಲ್ಪ ಕ್ಲಾಸ್ ಮಾಡ್ತೀವಿ. ಸಿಕ್ತು ಸರ್, ಅದು ಸ್ವಲ್ಪ ಶೇಕ್ ಮತ್ತೆ ನಾವು ಕರ್ಕೊಂಡು ನಿಮ್ಮ ಮೈಕ್ ರೆಡಿ ಮಾಡ್ಕೊಳ್ಳಿ.
ನಮ್ಮ ಸಂಸ್ಥೆಯ ಸಮಾವೇಶದಲ್ಲಿ ನಾನಾ ಕಡೆಯಿಂದ ನಮ್ಮ ದೇಶದಿಂದ ಮಾತ್ರ ಅಲ್ಲ, ಹಲವಾರು ದೇಶದಿಂದ ಕೂಡ 15,000 ಪ್ರಸೂತಿ ಹಾಗೂ ತಜ್ಞರು ಒಂದೇ ಕಡೆ ಆಗಮಿಸಿ ಅಲ್ಲಿಗೆ ಒಂದು 10 ಕಡೆ ಹಲವಾರು ವಿಷಯಗಳ ಬಗ್ಗೆ ಮಕ್ಕಳು ಹದಿಹರೆಯರು ಹಾಗೂ ಮಹಿಳೆಯರು ಹಾಗೂ ವಯಸ್ಸಾದ ಮಹಿಳೆಯರು ಎಲ್ಲ ಏಜ್ ರೇಂಜ್ ನಾವು ಟಾಪಿಕ್ಸ್ ಕವರ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ನಾವು ವಿಶೇಷವಾಗಿ ಅವರಿಗೆ ಯಾವ ರೀತಿಯ ಕಾಂಪಿಟೇಷನ್ಸ್ ಮಾಡೋದು, ಒಂದು ವಿಷಯ ಅಂತ ನಾವು ಹೇಳೋಕ್ಕಾಗಲ್ಲ. ಲರ್ನಿಂಗ್ ಆ್ಯಂಡ್ ಟೀಚಿಂಗ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಅಂತ ನಾವು ಹೇಳ್ತೀವಿ. ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇನ್ ಮೆನಿ ಡಿಫ್ರೆಂಟ್ ವೇಸ್. ಯಾಕಂದರೆ ಒಬ್ಬರನ್ನೊಬ್ಬರನ್ನ ನಾವು ಭೇಟಿಯಾದಾಗ, ನಾವು ವಿಚಾರದಿಂದ ಚರ್ಚೆ ಮಾಡಿದಾಗ ಅವ್ರೇನು ಮಾತಾಡ್ತಾರೆ, ನಾವೇನು ಮಾಡ್ತೀವಿ, ಸೇರ್ಕೊಂಡು ಮಾಡ್ಬೋದು. ಕೊಲಾಬ್ರೇಟ್ ಆ್ಯಂಡ್ ಗೆಟ್ ಮೂವಿಂಗ್. ಡಾಕ್ಟರ್ಗಳು ಬರ್ತಾರೆ, ಕೆಲಸ ಮಾಡೋರು ಬರ್ತಾರೆ, ಫಾರ್ಮಾ ಕಂಪನಿಗಳು ಬರ್ತಾರೆ, ಬೇರೆ ಸೆಕ್ಟರ್ಸ್ ಇಲ್ಲ, ಫೈನಾನ್ಸ್ ಸೆಕ್ಟರ್ ಇರ್ಬೋದು, ಇನ್ಶೂರೆನ್ಸ್ ಸೆಕ್ಟರ್ ಇರ್ಬೋದು, ಅವರು ಕೂಡ ಬಂದು ನಮ್ಮ ಜೊತೆ ವಿಚಾರ ಒಟ್ಟಿನಲ್ಲಿ ಒಂದೇ ಒಂದು ಸಮಾವೇಶದಲ್ಲಿ ಹಲವಾರು ಥರದ ಅನುಭವ, ಹಲವಾರು ನಾವು ಮಹಿಳೆಯನ್ನು ಯಾವ ರೀತಿಯಲ್ಲಿ ಸೇಫ್ ಆಗಿ, ಸ್ಟ್ರಾಂಗ್ ಆಗಿ, ಸ್ಮಾರ್ಟ್ ಆಗಿ ಎಲ್ಲ ಕಡೆಯಿಂದ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಬಂದಿದ್ದಾರೆ. ಅದಕ್ಕೆ ನಾವು ಮೇನಂತ ನಮ್ಮಲ್ಲಿ ಅಷ್ಟೇ ನ್ಯಾಚುರಲ್ ಥರನೇ ನಮ್ಮಲ್ಲೂ ಕೂಡ ಸ್ಪೀಕರ್ಸ್ ಇದ್ದಾರೆ. ಸೊ ಒಂದು ಸುಮಾರು 2,000 ಸ್ಪೀಕರ್ಸ್ ನೀವು ಯಾವ ದೃಷ್ಟಿಯಿಂದ ಯಾರು ನೋಡಿದ್ರು ಅದು ನೀವು ಮೇನಂತಾನೆ ಹೇಳ್ಬೋದು. ಯಾಕಂದರೆ ಡಾಕ್ಟರ್ ಹರ್ಷನ್ ಸರ್ ಒಂದು ರೇಷನ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಅವ್ರ ಕಾಲ್ ಸೆಕ್ಷನಲ್ಲಿ ಸಂಸ್ಥೆ ನಾವೇ ಯಾವ ರೀತಿಯಲ್ಲಿ ನಾವು ಸುಮ್ಮನೆ ಕೆಲಸ ಮಾಡಿದ್ರೆ ಆಗಿಲ್ಲ, ಉತ್ತಮ ಗುಣಮಟ್ಟದ ಕೆಲಸ ಮಾಡಬೇಕು ಅನ್ನೋ ವಿಚಾರವಾಗಿ ಚರ್ಚೆ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. Prevention is better than cure. That is ಇಲ್ಲ ಭಾಗಗಳಿರುತ್ತೆ. ಒಂದು ಅವೇರ್ನೆಸ್ ಭಾಗ, ಇನ್ನೊಂದು ನಾವು
ಬೆಳಗ್ಗೆಯಿಂದಾನೇ ಮಾಡ್ಬೇಕು.